Good evening, good evening, good evening, everyone. And my sister Marlene has welcomed each and everyone. It's a privilege for me to be able to take part in this presentation. My name is Sister Angela, and I'm a registered nurse. I work in mental health department. So continuing from last night, Sister Marlene spoke about men's health issue, and she focused on prostate cancer and testicular cancer. Tonight, I'm gonna continue, but before I talk about prostate cancer and effects it has on your mental health in men, I'll just talk a little about other mental health issues that men do have to go through and deal with. So here we go. So mental issue affect people of every gender. And while the specific may differ, it is incorrect or wrong to assume that men don't struggle simply because they are often portrayed or expected to be strong and silent. This expectation is rooted in men being men. You know, we all grew up in culture saying, oh, man have to be man up and be strong. And this result in poor mental health and its outcome. Men are less likely than women to be diagnosed with any or the most common mental health disorder. And those who have received a diagnosis are less likely to seek treatment. Yet nearly 4 times as many men as women die from suicide. In Canada, of the estimated 4,000 suicide deaths in Canada each year, close to 75% are men. So we know that, therefore, why don't men receive diagnosis and care they need to heal from common mental illness? Can somebody answer that? Why don't what you think? Why don't men on a whole receive the diagnosis and care they need to help or to heal from common mental health disorder? Somebody let me know what they think.
Okay. I think what happened is that most men do not seek help, even for other physical issues. It's usually their wives or some other person's female would say, you need to get help. You need to go get seen because of what you're going through. So not seeking help is the first setback. And also, even if they get a diagnosis, not acknowledging or feel like they need to tough it out and deal with it mentally on their own without interventions.
Anybody else? Thank you, Sister Marlene. You said exactly what I basically have on my paper, which is good. Anybody else? Okay. So social norms around gender teaches that they should emotionally be strong, like Sister Marlene says, and avoid showing their feelings or asking for help from others. In addition, men sometimes lack what is known as mental health literacy, which means the ability to recognize, identify, and describe the emotion of what they are feeling. So, because of all these norms and what society or the cultural you're expecting of you, you avoid going to the doctor, number one. And if you do go to the doctor and you get the diagnosis, say, cha, doctor don't know where my talk say, or, it's nothing, it's just, and just minimize it. And that's what that's what you're taught to be. That's what you were grow up to be, especially us as Caribbean, men. Um, we need to, they said they have to be strong. So therefore, men who are, like I said, therefore men who are experience mental health problem tends to downplay or minimize their. They don't acknowledge what they're going through. They're in denial and are also reluctant to seek help. They have difficulty accepting what they are feeling, therefore mistaken depression and or anxiety as normal stress. You just say, oh, it's just something that I'm going through. It's gonna blow over, and just sweep it under the carpet. They believe they should be able to handle their feelings on their own without any professional help. They don't need to go to the doctor. Can talk to my body and he will just, talk to me and counsel me and I'll be okay. They don't talk or share with their doctors or caregiver about their emotion and what their experience because they don't want to the fear of looking weak or say you're a soft man. Men tend to suffer more in silence because, like I said, they don't tend to talk openly about their struggles, such as feeling sad or down. Sometimes they feel worthless, like they don't have any use, anxious, or even hopeless. As a result, these mental issues often go undiagnosed or misdiagnosed. This means that this means that far more men are suffering than what the statistics shows. So why don't men receive the diagnosis and care they need to heal from this mental disorder? They hide. They don't talk, like I said. And because they don't want the stigma. They don't want to be classed as they're being crazy or or they're not having any sense. So I'm going to talk about the most common mental health issue in men. There's quite a few, but I'm going to deal with a couple that it's more likely men go through this without any other physical or chemical any other diagnosis which is much more severe. So the first, depression. This is the most common mental issue among men, sometimes called male depression. A simple definition of depression is characterized by a low mood or loss of pleasure or interest in any activities for a long period of time. This can be a minor or a severe depression. And this is different from regular mood change and feeling about everyday life. It is a constant feeling of sadness, don't want to do anything. And this prevents you from going about your normal daily living. You don't want to get up, you just want to sleep in bed, or you just, isolate yourself. Some signs of depression in men are aggression and violence. Just get angry, do stuff without any you know, concrete reason. You yourself wondering what's happening. High risk behavior. For example, you start gambling, you start going out, doing things that you would normally do. You have problem with substance use, such as binge drinking and finding other form of drugs to use. I think it's later on, but you can use, they tend to use pain medication, over-the-counter medication, like cough syrup, Tylenol, Gravel, quite a few of those medications men tend to use. Just kind of give them a little bit of calm when they're going through these illness. Physical issues such as chronic headaches or stomach, feeling restlessness and difficulty focusing. You have change in appetite and weight, and this could be increased weight or just losing weight without any really reason why. And fatigue. You get according to National Mental Health Institution, 49% men feel depressed than they're willing to admit to people around them. So, any study, any survey or anything that is done might not be the actual count. Men tend to not want to talk, and then you don't get the accurate count. And 45% believe mental health issue can be solved on their own. And this survey by the National Mental Institution was a survey done on 1,000 men. So almost 50% feel depressed than they are willing to admit, and 45% believe that mental health issues can be solved on their own. So that's depression in a little nut. Anxiety disorder is also another common male mental health issue. Anxiety is the feeling of fear, dread, and uneasiness. Another, sorry, and I have another explanation, another definition, but I'll find it later. Type of anxiety disorder in men include panic disorder, which is sudden periods of intense fear, palpitation, sweating, shaking, numbness, and short of breath. Obsessive compulsive disorder is also a type of anxiety, and that is intrusive thoughts and feel the need to perform certain routines or activity repeatedly to relieve that need. For example, I work with a client who she has OCD, and what she does is that every garbage can that she passes, she has to touch it. She go take a few steps and she come back and she touch. If she go again and she touch, and she'll do that about 3-4 times before she leaves the office or leaves the room. That's that. Hers is really severe. Another one, easy, I think common one is washing your hand. People wash their hand, like feel it's sore. They have to like use Vaseline or something. Their hands are so sore, and it's just you can't tell them that their hands are not dirty. You can't tell them that because in their mind, in their head, they think it's dirty, and they have to do it. And if they don't get to do it, it's like it set off another set of panic and cause more harm. So sometimes you have to just allow them to do it. Social anxiety, not able to be in public space, crowd. You get nervous, you get, sweaty, same similar thing like a panic disorder. Basically, you get panicky. You have phobias, fear of something. Some of the symptoms of anxiety can be the feeling of worry and stress that you can't control. A sense, like I said, of restlessness or being on the edge. It's like you're worked up and you don't even know what's causing you to work up. And you don't even have to have a diagnosis of depression or anxiety to get anxious. It's just that as we would say, normal, we do get anxious, but we have some form of control over it. While the others, it's like they're going to die. They feel differently. Sleep problem. You're sleeping too much or you're insomnia, you're not able to sleep at all. Physical symptoms can be muscle pain, stomach ache, and headache that cannot be explained. You have nausea, sweating, and shaking, especially if you're in a crowd. And again, that's a form of social anxiety. Avoidance, isolation, staying away from situation or place that triggers this feeling. Okay. Another substance abuse also is also one of the male mental health issue. They tend to I think the most common I would say substance abuse is that it's alcohol. Because you have some men, they'll sit home and they'll drink. They'll so work up in their head that they, to calm them down, they have to numb their feelings, like I said. So they'll use alcohol, they'll use drugs, marijuana, prescribed painkillers, and just to bring them down on a low level where they can function. Another is PTSD, which is another of the most common mental health issue in men. Moreover, PTSD it's not just something military veterans suffer from. We talk about PTSD already, say, oh, were you in the army or were you in, that doesn't necessarily have to be. At least approximately 60% of men suffer at least one trauma in their lives. Example, death or injury, physical assault, or witness to some death or injury. And this is just a few. And while PTSD diagnosis is more common in women than men, again, it is suspected that this may be also due to men lack of reporting their experience and they suffer in silence. Some of the symptoms of PTSD: flashback to the traumatic event, panic attack, confusion, lack of focus, difficulty making decision, nightmares, insomnia, and other sleeping issues. If you're listening, most of the symptoms are intertwined. They all overlap then, put it that way. So another thing, if you are experience any of these and you go to the doctor and you tell them, what they'll do, they'll look at all the common symptoms that you have. And if you have like a certain, say you have 6 out of 10, then they'll lean more to, whatever their guide is, then they'll diagnose you as with that. But most of them are overlapped. Irritable or aggressive behavior again, a feeling of lack thereof, emotional numbness. You feel hyper, alertness, and suicidal thoughts. Some treatment for the common male mental issues include psychiatric care, including medication management, individual therapy to address issues and build healthy coping skills. Then you have group therapy. Men will know that they're not the only ones going through the issues. You know, when you go into a group therapy, you have other men who are giving their you know, if their experience, what they're going through. So when the other men hear somebody, oh, it's not just me, somebody else is going through it, and it kind of give them a little better to really talk and, you know, express themselves. Family therapy to address problem in their relationship with loved ones, your children, your spouse. Provide other resource, especially community resource. Last but not least, you have your faith and your belief in God, knowing that He's able to heal and fix all that is broken. Nothing is impossible for Him. So men, we need to be open, honest, and seek help. Put your society and cultural belief aside and communicate. You have to talk, open up. And ladies, some of the emotional support we can offer is to listen. The number one is listening, communicate, giving the men space to talk, listening to know how they're feeling. Really listen, don't interrupt them when they're talking. This can be really helpful and also be non-judgmental. Offer reassurance, seeking help. Seeking help can feel lonely and somewhat scary. Stay calm, be patient, and try not to make an assumption. As to the, like I said, Marlene talked about prostate cancer last night. And most of these mental health issues that I talked about, men who are diagnosed with prostate cancer do go through these psychological issues. Psychological and social issues arise in 30 to 50% of prostate cancer patients, irrespective of the stage and progression of cancer or the type of treatment they receive. But with effective assessment and intervention, clinicians can help to recognize any troublesome and disturbing problem, reduce their negative impact, and enhance the quality of life for patients and those close to them. Like I said, I'm going to go repeat again. Some of the psychological issues that are commonly seen in prostate cancer is anxiety related to the cancer and its prognosis, depression and depressive symptoms, guilt and remorse after a diagnosis. Men feel guilty. What did I do? What's going to happen to me? Fear about the PSA assessment. Fear about recurrence of the cancer after treatment. Making a psychotic diagnosis in a prostate cancer patient can be complicated due to overlapping symptoms, like I mentioned before. These include fatigue, weight loss, sleep disturbance, loss of appetite, and anxiety. So these could also go back into a part of the mental health issues. So that's why it says complicated, but the doctors and the caregiver, would be able to sort it out. To establish a psychiatric diagnosis in this patient, urologists should be trained to identify the following psychological or cognitive symptoms: feeling a lack of pleasure, depressed mood, hopelessness, and helplessness, along with anxiousness. One of the psychological aspects in prostate cancer, and is the big one, is ED, which is erectile dysfunction. It's a complication feared by many, many men diagnosed with prostate cancer. For those men who are particularly bothered by sexual dysfunction, the first step should be a consultation with your urologist, who specializes in male sexual function. Sex therapy with a trained therapist may help a man express their feelings engendered by this dysfunction, and may help with a couple learning alternate way of sharing. Another confusing aspect for selecting treatment is the different impact on ED in radical prostatectomy versus radiation therapy. That's another decision that men do have to make. I think Stamarlin talked about it last night. That it's something that you have to sit down with the doctors, caregivers, and they'll give plans. And although medically you're going to make a decision, emotionally you have to make that decision in which the treatment you want. They both have their pros and their cons, and every person is different. Treatment that works for one person might not work for the other person. So it's an individual decision. I know my dad died 8 years ago with prostate cancer, and he would the doctor caught it really early, and he would not, doesn't matter how we talk with him, I went with him to the doctor, Sunnybrook, he gets all the information and stuff. He was encouraged to do the surgery. Said he's not going to do it, and he was in his 70s, but he wouldn't do the surgery, only because he hear what people say. Oh, you want this, you want that. I sat with him and I give him examples. He wouldn't. While we were in the waiting room, there's a gentleman there, and I think he overheard us talking. And he came over and he said, I did the surgery. And he basically gave his whole treatment thing to my dad, hoping that would encourage him to to consider this. And he didn't consider the surgery. Well, my dad lived for maybe another 1.5 years because it really progressed, So what I'm saying is that, men, you can do your homework, talk with your caregiver, and make the right decision. The rate of depression was extremely high in men with ED and was significantly higher than men in the control group with BPH. It is likely that the presence of distress or depression related to ED may lead to relationship problem due to the increased stress on the couple. Men with experienced ED usually avoid sexual contact and sexual intimacy. Like, this is another cause issues in your marriage and in your in a relationship. Some men report that there's no use starting sexual contact when they cannot, perform. They think it's a lack of manliness, and this often increase their distress in their depression, over the loss of, their sexual functioning. So back to where I said depression, anxiety, and I think the other one, they're the most common mental issue that men do go through. And with prostate cancer diagnosis, it's even increase the risk of you having any one of these diagnoses. The clinical significance of psychological distress, particularly depression, experienced by men, has yet to be addressed adequately in the research literature. I tried to find some stuff in paper within, and it was hard to find some. There wasn't much information, especially in Canada on men in mental health. Like, you find a little bit here and there, but wasn't available. So few studies has examined the prevalence of depression in men with prostate cancer. A few experimental studies have tested the effectiveness of intervention, targeting depression or mood as an outcome. So I think so I think that's it for me. And any question?
I posted in the chat.
Oh, okay. Hold on.
You want me to read it?
I'm going to. Okay, what about the belief that mental illness is demonic? How does that belief affect the individual getting help? That's a big one, Sister Marlo. But what I can say is that for me, working with mental health clients, from a medical point of view, is that majority of the clients, there are markers that you look for. In a medical, in a client that's diagnosed with a mental issue. Now, there are things that the doctors look for. I just read out some that's more mental, like it's, you're expressing how you feel, and there are signs and symptoms. Now, the doctors do their they run their tests. They do chemical imbalance, like they check for dopamine, serotonin, and I think there's another one that they look for. If it's increased or it's decreased, then they can make the diagnosis of schizophrenia, whatever. Now, I'm going to be honest when it comes to saying if they are these kinds are demonic. Spiritually, which I think Brother Pastor Owen is going to talk about a little bit, is that my experience is that as a Christian, I've had clients that once I approach them or interact with them, I know that I wasn't dealing with them as a person. There's an instant where one of the clients, I'm trying not to stay a little bit. One of the clients, anytime I approach her, and she's well, as I would say in her right mind, she's the nicest person. And I'll stay at the top of the nursery and I'll say, hey, it's Angela. And she said, hey, what are you doing? I didn't know you were working, blah, blah, blah. But if she is, myself, and I hope I'm not judging her wrong, but I think she has some demons in her. Because when I do approach her in certain instant, oh my, her whole features is changed. She cursed me, or she tell me the longest a bad word and stuff that you could hear. I don't hear those bad words in Jamaica, but her whole physical thing is changed. And my spirit, Holy Spirit in me, like it just went wild. And I have to remember that I'm at work. But I could tell. And then give her an hour, 2 hour. And I'll go back down and I said, hey, what's up? Are you feeling better? What are you talking about? And I said, you weren't feeling well earlier. Oh, what are you talking about? And she would not remember what happened. And this is something that I've worked with her for years. And this is what I've did. So in my mind, I don't know how to explain it, but I think so it can be in my experience can be demonic. I don't know if I'm judging her wrongfully. Maybe with something that we could look further in and have or somebody can explain it. But that's my my take on it. So it does affect people getting treatment. Again, this client and their family, we had a hard time getting them to take medication because the family, especially the mom, says that it's nothing is wrong with them. People do that, people do are so, and I guess it's proper English. People work voodoo or obia and stuff. So with that belief, you know, you have a hard time getting treatment. Now, back to us as Christian men. Yes, we have our faith, and you know, you go to the doctor say, you know, this is what's happening. We can use wisdom. Yes, we could pray, and you know, God will take care of it. But we still can put aside these medical doctors that are same God as created and given the skill to help us. I don't know if that answered the question.
I hear you. I think overall, I believe that if the Holy Spirit instill in a person to say that this individual, what illness the person has is demonic, then I would say yes, you go ahead. But to say overall any form of mental illness is demonic, I personally think that is wrong, and it will delay getting help, and then the longer you stay without getting intervention, the longer it takes for you to get normalized and stable enough to function. So that's what I can say about it. And we learn in school that's one of the biggest hindrances as it relates to mental health.
Does anybody else on the line have anything to say about the question was, what about the belief that mental illness is demonic? And how does that belief affect the individual in getting help? Anybody else has anything to say?
Brother Paul here.
Okay.
I don't think it's demonic, but a lot of time people, when they cannot figure things out, they tend to want to put demons into it.
True.
People cannot figure out what kind of sickness. First thing they come up, or maybe a spirit. So I think sometimes we tend to push demons too much in things that we can't diagnose. So that's my input on it. I don't think so.
Hi, can
Yeah,
I speak?
Go
I
ahead.
thought I was speaking before, but I was on mute. And I totally agree with Brother Paul on that point, that because when you look back over the years in our lives growing up, the many things that our foreparents were saying that was demonic, because as Brother Paul rightly said, they did not understand it. And just listen to you describe your experience with that person, Sister Angela, I'm thinking of the illness that I'm sure you and Sister Marilyn know more about, multiple personality disorder. Because it sounded like that to me when you were describing it, and it is true that at times you will have the sickness manifesting in the person, and other times it will be demonic. But like you said, like the Holy Spirit in you witnessed to you that it was more of a demonic attack that was happening. So I do believe that it could be demonic, and the person can have the mental illness, which is multiple personality disorder. So, it is important to recognize that, because as the question asked, if you fail to do that, people are going to go undiagnosed. Thank you.
Thank you, Sister Judy. Thank you, Brother Paul. Anybody else?
yeah, I'm in agreement with that as well. Good night, it's Brother
Yeah, Brother
Siobhan.
Shiva.
Thank you for the info. You know what? When we think about it, even growing up, mental health, there's no education like in terms of people growing up back. Because I have an uncle who he has mental health, but when I was growing up and so forth, they used to say, adopt it upon him, a crosses, right? Or somebody, a blow or something of the sort. And like even come to think about it, there was other family members as well, and other family in other or a family member in other families who also suffered from mental illness. And the problem is, I think, is this the educational piece of it. And when we don't know something and it's not diagnosed, then it's just easy to stray away from it, or just to give it this is what the reason this thing is. And then it so happened that generation, and you just continue with that same thing because this is what you're growing up learning, or growing up people are telling you about. This is what it is. So now you're thinking this is it. And now in Canada, okay, the educational aspect of it and being informed, right? So you know what to look for, and there's different levels, different things, right? And it is so prevalent in families and in communities and stuff. But in Jamaica, and when you look at, there's a lot of the issues there where now you'll see them now, it's as though they're outcasts, right? And I don't like using that word or so, but that's what it is, because now nobody knows how to deal with them, right? And people stay away from it, or just stay out of their way, or just banish them in a sense, right? But no, because you don't, and there's no medication, they're not properly diagnosed, right? And it's just easy, as Brother Paul and Sister Judy allude to as well. It's just like we don't know. It's not we're not sure, so let us just give it that title and just leave it at that. And then because of that, now it deteriorates and it gets worse, right? Where now if someone was properly diagnosed and they're on the right medication, they can live a life which can be fruitful, live a life that can be enjoyable, opposed to just being vanished or being banished out of a family because no medication and there's no diagnosis, right? And this is plaguing, this is an issue in Jamaica, right? And we see it as the numbers are growing. And yet now there's educational aspect and it's being seen, right? So now you start seeing that there's more and more people that suffer from mental illness, right? But because now it's not diagnosed properly, and then the educational aspect, we're unaware, we don't know. And then, because now, yeah, there's a light that's been shined on it. But now when you look back, even growing up, there was the issue was still there, right? And now the 21st century, there's help, there is medication, there is sort of medications and stuff to help them, right? And even the multiple personality, schizophrenia, all of that stuff. And it's because we're not educated. And I do see it too, especially in the Caribbean. They will just say, yeah, it's demonic, right? So thank you.
Thank you, Brother Shaban. Nice input. Sister Karen Hall, go ahead.
Good evening, Sister Angela. Thank you so much. Good evening, everyone. Yes, Brother Siobhan, you said it with Brother Paul. I think culturally we're still attaching stigma to being unwell mentally. And I guess for so long we've hidden those family members. We've kind of put them out of the way, just send them to country, where they're out of the way. And because of the state of being undiagnosed, we miss sometimes that what's really going on is the fact that these are genetic things. And so it perpetuates itself, generation after generation. I think one of the things that we need to remember is look back with Job. Remember when Job had his illness? They couldn't figure why. And so imagine they turned to blame him, and it must be something that he had done. And that's exactly what we continue to do when we don't understand. When we look at someone and we're thinking, I know my mother would not say this, my mother would not do this. But we tend to forget that chemically our mother isn't balanced. And because you're not balanced, you're not operating in a way that you've always known that client, you've always known that resident. And so you think it's got to be the unnatural that's happening. And sometimes we need to take that veil off, take that shame off, take that stigma off, and allow patients to be treated, allow the clients to be treated properly, because we do have the means to take care of folks that are chemically out of line. But because we use these words, there was a time when everyone thought that if someone had dementia, that they were not saved. And that is so untrue. And we forget that a lot of these are regressive diseases. And so as the person goes back and back and back and back, they are no longer the person who got saved at 35 and began preaching at 40 and healing at 50, because now they're 80, right? So we tend to be so heavily judgmental. And you know what it is? One of the things is we carry such a heavy shame game and a blame game. And we need to step outside of those things and step away from those things and believe that if Jesus walked with a doctor, we need a doctor too. And let the thing go, but in everything, do pray and do believe. But sometimes we must marry the treatments of prayer and medicine. That's my 2 cents. Thank you.
Thank you, Sister Karen. Thank you.
Okay.
Yes, like Sister Karen says, even when I'm dealing with clients that are diagnosed with mental illness, what we're doing now, we have to have programs that family members, the caregiver, that they do also get information. Like we have to group with them so they have an understanding of what their loved ones are going through. So education, we're not just educating the client, we're doing the family or whoever is around them, that they have an understanding of what the client is going through. So like you said, we have come a long way, Brother Shaban, we have come a long way. And it's not just Jamaica, believe me, it's here. Because a lot of the time we have clients that we have to go around their family member or their next of the substitute decision maker to get consent to treat, because in their head, different countries, they still have in their head, oh, it's my son or my daughter can't be mental illness. It's nothing like that. It's not it, and that block the client from getting the proper treatment. So it's not just Jamaica. Yes, we're Jamaican, so with other countries, like multiple countries, you'll be surprised some of the countries that they have that belief that their client, their family member cannot have mental illness, and the signs are right there, and they're saying, oh, it's just something that they're going through, and it's gonna get better, but it never does. So education is a big thing, and communication. you know, everybody's on the same page. And just to make note, my resources that for tonight was the men's mental health and suicide in Canada, mental health, a national mental health statistic, and Newport Institute of America. All right, Sister Marlene, over to you.
Yeah, I was just saying because questions were coming in, if we want to continue, that would be okay. Or if Pastor Owen wanted to start, because we now have Friday night where we could go into spiritual aspect.
Yeah, he said it's okay. I did ask him. He said it's okay. He'll do it on Friday.
Okay.
We'll do the spiritual part on Friday.
Yes. So if you have any more questions or any comment about the presentation, you can do that.
Brother Paul jumping on again. Just want to commend you. I'm so happy that I logged on tonight. There's so much information, very informative. You know, when you spoke about the mental health issue too, I just rewind to a coworker of mine last week, and I saw him look very down, and I'm like, what's going on, man? And he started telling me about work and what he's going through, and he just started to get some psychiatric help because he's so depressed. And we chat for about an hour. And by the time we finished chat, he said to me, thank you. You don't know how much you have helped me just talking to me for an hour. I think you even helped me more than my psychiatrist because I needed somebody just to talk to and encourage me and remind me that I can pray. And it felt so good. And I just, you know, you talk about it tonight. Sometimes it's just about, you know, approaching somebody sometimes and ask them how they're doing, or, you know, see how you can help in whichever way. You would be surprised sometimes the difference it makes. Today again, he saw me and he's like, thank you. And I never even realized how much help I was giving this one person. You know, so we have to learn to open up sometime and talk, you know.
Yes, thank you, Brother Paul. That was good.
That's what exactly. Sorry, go ahead, Sister.
Yeah, that's what, you know, it's good, Brother Paul, because like you said, he said you help him more than how his psychiatrist would, because he can talk to you from where he's at. Because sometimes when I sit with a psychiatrist and they're talking to these clients, and I'm thinking, they're not getting it. They're not understanding it because they're either using stuff that, you know, is going over their head and you know, and they're not understanding. They're not getting it. They're, you know, as I'm not putting down the psychiatrist, but as they talk, they don't try to understand from the client's point of, you know, where they are at. They're just going with their paper and they're asking these questions. Quickly, Stamarley, I'm going to give this this quick example. I was with the psychiatrist and a client, a Jamaican, and you know, back home we talk about well, not even Jamaican. Let me do this one where we talk about like our Heavenly Father. God is our Father, right? We are his children. We are his son. We are his daughter. And this client, he has schizophrenia, and he's really just preoccupied. I can't judge. I can't judge where his childhood is coming from, but based on, you know, talking to him and stuff, he grew up in church. He knows a lot about the Bible. He knows, you know, so he sat we sat in the conference with the psychiatrist, and the psychiatrist asked him something, and he says, yeah, my father, God is my father. My father is up in heaven. And the psychiatrist looked at him and said, no, is he your father? Yes, he's my father. And I'm thinking, I can't interrupt because I'm just there as a caseworker for this client. But afterward, after he left, after the client left, I turned to the psychiatrist and I said, in my mind, I might get fired, but I turned to him and I said, I called him and I said, just going back to what you asked the client a while ago. He's Jamaican and I'm Jamaican. I'm a Christian. We all grew up. We learned that we're a child of God, our Heavenly Father. He's saying that his biological father is in heaven. He's talking about his Heavenly Father. And he looked at me and he said, oh, I wasn't even thinking that. And all along, if you look in this guy's chart, they're saying he's delusional. He's grandiose because he's thinking his father. And then when I brought it to the psychiatrist's attention, he looked and said, oh, okay. And when next he asked him, he rephrased the question. He said, who is your biological father? And the guy turned and said, oh, I don't know. I haven't seen him since I was a little kid. And he said, do you have any other father? And he said, yes, God, I'm a father. Talking in patois. And he got a better understanding of it. So, it's a lot of time clients, I have to say, don't get the proper thing because of their culture. And, us as caregiver, us as nurse too, as caregiver, if we don't understand the clients and their culture, we don't give the proper treatment. Go ahead, Sister Marlene.
And that's where cultural competence comes into play.
Exactly.
And I don't think one can ever be culturally competent in any way. We just keep learning and learning.
Yes.
I know someone who got into big trouble because she said to someone, the baby was crying, and she said to the parent, hush the baby. And in our culture, it means to comfort the baby. In that culture, it means to shut up the baby. So she was reported to one, and they were almost ready to take her out of the community because she had offended them. And it had to go back. It so happened that one of the supervisors was aware of the culture. That means it's an endearment to say, comfort the child, and was able to relay what that means. But it created a big stir just because of that word. When she told me what she said, I said, are you crazy? Why would you say that? She said, I didn't know. I said, you should have known. You should have known by now that that word means different things to different cultures. So we have to be mindful of that. Okay, so any more comment, any more questions about mental health or how we go about it moving forward? Men, what are you gonna do about it?
Sister Marilyn, me again, Sister Judy again. This one is just on my mind so much, I have to share it. I don't remember the details of it 100%, but I remember the first time I heard about multiple, maybe not the first time, I'd heard about it before, but I sat in on a lecture, a class where they were talking about it, and I remember the person spoke about the genesis of multiple personality disorder in some people. I know that all of us have compassion, and we ache when we hear that a child is molested. And the example that was being shared was about a child that was molested in their youth, and they grew up with this injury all their life and became an adult. And the safe place, the child would find a safe place where they curl themselves up in the fetal position and rock themselves. to comfort themselves when danger was near, or when the assault had subsided. That's what they would do to comfort themselves. And that experience remained with the child. And as an adult, the child still didn't get over it, because it started happening from young, so it was in their subconscious. But the action remained with the child, and in their adults, still struggling, not understanding everything that happened to them, even though the person was at adult age, when they faced trauma or anything that would trigger them, they went back in that fetal baby position, and other things manifested for this adult that showed a different personality. And that was a part of the whole person, the 20-odd-year-old person, and the person that will go back to that childlike state and talk in a baby voice, and all of that. And all of that comprised multiple personality disorder. So I just wanted to mention that, because after I shared this, came back to my mind, and just to let us know that it is real, and children that we love so much, the genesis of these things, of multiple personality disorder, could begin in their childhood, and the responses that they use to comfort themselves can be manifested later on in their life. And they speak in an adult voice, and then they go back in a baby voice, and all of that. So it is real. I just wanted to share that because it came back to my memory after I shared. Thank you.
Yes, it's definitely real, and that what you describe is comes about as a coping mechanism because of the trauma, in order to survive. So when they go into different personality, they're able to balance and cope and not go under. Am I right, Sister Angela?
Yes. It's one of the coping mechanism is to take yourself away from that reality and go into alternate reality and alternate reality space where you feel safe. So, and Sister Judy is right. It could start from child, but even in adulthood, you tend to be somebody else. Or, you could be say as you could want to be like an actress, and you pretend that you're that actress. It comes in different stages, but it is real.
Okay. All right. So thanks everyone for joining and for participating. Just a moment. I want to acknowledge people from different places. I ask people to post in the chat where you're logging in from, and let us know so we can identify you if you choose to. But I want to personally welcome my brother-in-law that's on. Owen, I see that you're on. Welcome. That's Noel's youngest brother. And thanks for joining, and I hope that you gain something from there. I'm not sure if Tony is on. He's in England, and it's after midnight in England. He said he would try and log on. If you are on, I welcome you also. And anyone from West Toronto Church or any other churches that log on, we welcome you. And of course, COP, thank you for joining with us tonight. Galaxy, Galaxy, you can go ahead.
Yes, ma'am. This is Brother Lloyd.
Thank you. Hi, Brother Lloyd.
Yes, ma'am. And I've been listening. Your program is very informative, and I myself, as a caregiver, have to learn a new way how to deal with my patient, and I have to be spiritually strong, because being a caregiver with anyone with mental health is very stressful. It's very stressful. So I just want to say you have to be spiritual strong to deal with your patient with with who is going through like dementia and stuff like that, because they're back like a baby and stuff like that, and we just need each other help in prayers, and you know, just to talk to someone sometimes it's a great help to someone who's going through that, not really going through, who is really being the forefront, being the prime caregiver for somebody like my wife and stuff like that. So I'm just thankful for your program, and I think it will do a lot to other men, like you're saying, like we Jamaican. But you know, when you come here, when you reach to a position, when you're in a position, you have to take the proper step and you have to seek God for what you do and everything like that. So that's where my little point is. Thank you, ma'am.
Thank you, Brother Lloyd. And I have dealt in the past about caregiver burnout that we need to be aware of and how to manage that. And there's
Yeah.
lots of different things, you know, support group, people, and any other caregiver that's having the same issues like you can be of support, and getting someone to stay with your wife so that you can go out, a change of scenery, and all the different things that you can do to maintain a good balance so that you don't experience burnout, or your burnout will be minimal.
The government, they give actually the Alzheimer's Society, they give you
Okay.
have opportunity to like, she goes by the center 2 days a week, so I have a little time for myself. I could go do what I have to do and so on. It's very helpful and stuff like that. So that's very good. And like you say, they have support group that they call, and even online they would encourage and hear what other caregivers are going through and stuff like that. So there's a big support group here that can help, that will help you to go through all these things.
Awesome. Thank you. Thank you for sharing that, Brother Lloyd. I'm going to let
Thank you.
Pastor Owen do the finishing, because since it's your night, I will hand over to you, Pastor Owen, and you do the finishing. And people, we just value your staying on a little bit over. And if there's someone else that wanted to comment, I'll let Pastor Owen facilitate that. God bless you.
Sister Marlene, he wants you to finish up. I think he thought he was
Thought it was free.
Was off for the night, yeah.
Oh, there. Okay. All right. Thanks everyone for joining. Is there any urgent prayer request? Okay. So we're gonna close off tonight. And thanks everyone. Thanks, Sister Angela. And again, for last night, that was amazing. I want to thank everyone, and especially Sister Thelma, for all that wonderful and important information that was very current that she provided to us as it relates to chemo treatment and all that. Because it's good to know what is currently out there. So I do value that. And I really value like all the nurses that are from COP, who we pull together and provide information so that people can be as healthy as possible. And we are a team together. Okay.
Sister Marlene, just a quick note that I didn't mention is that men on the whole, if you are, think you're going through some form of mental issues or so, there's resources outside. You could go into any doctor's office, community center. Most hospital has a mental health department. You don't have to go in to see a doctor. Just go in and just ask, and you see pamphlets are there. You can find a resource, somebody you could talk to. You have therapy groups, individual groups and stuff. There are resources out there. I work at CAMH, and CAMH has a very good program where you go in and you could do it online. Don't really just go into CAMH.com and there's programs, there's stuff there that you could go in and get information. There are groups that you can attend. You don't have to be diagnosed with mental illness, but you're trying to get information. It's there. You just have to just reach out and ask. Okay, thanks, Marlene.
Awesome, awesome. So I'm going to give the announcement for the rest of the week and going on into the new year. Okay, so we are going through Movember. That's men's health. That is the focus of this month in November. And as we said, Movember has to do with encouraging men to grow their mustache in recognition awareness of prostate cancer. Okay, so we're doing that, and we're going to continue on Friday night. So tomorrow night we will be having Bible study starting at 7:30, and Thursday night at 8 p.m. we Team Kindness is still going on, and then Friday night we will continue the talk. Tomorrow morning at 5 a.m. we have Morning Glory. Please set your alarm and wake up and join. This weekend, the 15th to the 17th of November, is Young Adults Retreat in Paris Sound. And by now you should have known if you're going, and I've contacted our youth leader and did the registration. Marriage Enrichment Group session will be on this Saturday at 4:30 p.m. And if you are interested and haven't had the Zoom link as yet, you can contact me and I'll forward you the link. And this is an individual project. It's not affiliated with COP. Power Zone, November 22nd at 7 p.m. at Praise Cathedral Worship Center, 6785 Mill Creek Drive in Mississauga. Regional Care Ministry Christmas Banquet is on the 30th of November. And our COP Christmas Banquet is December 7th at 6 p.m. But appetizer starts at 5:30. So I think you should be there from, let's say you should be there from at least 5 p.m. And it's only $75 per person. Please contact Sister Michelle for your ticket. The retirement service for Bishop Trevor Brown and Reverend Jocelyn Brown will be on December 8th at 5 p.m. West Toronto Church, 1655 Wilson Avenue in North York. And Winterfest is February 14 to 16. Contact your youth leader. Ladies Retreat, March 21st to the 23rd, and registration is open. Contact Sister Michelle. So that's the announcement for right now. And I want to thank you for joining us tonight. Join us tomorrow on COP Prayer Line, where our mission is to lift up Christ as he draws people to himself, leading to transformed lives. And our vision is reaching the ears and hearts of listeners, bringing them into a community where love and healing can be found, touching hearts, changing lives. Let's raise our right hand as we repeat Psalms 29, verse 11. The Lord will give strength unto his people. The Lord will bless his people with peace. God bless you. Thanks for joining, and see you around the bend. Good night.
Good night.
And